You know what? This will probably make you very angry, but I think it's time we talk about it. Make you not be like, say, it's because we didn't say anything. That's why it's happening. Let's talk. Cancer. The numbers continue to rise. As a matter of fact, by the time you finish watching this video, somebody somewhere would have lost their battle against cancer, and then it's looking like we're not winning the battle. No matter who you are, whether you're rich, you're old, you're poor, you're young, you're yellow, you're dark, you're fair, even children who haven't even started living their lives are not exempted from cancer. If you live in Nigeria, in a country like Nigeria, where a lot of people pay out of pocket, there's trouble. Usually because the signs of cancer are very small at first. You usually whisper before it then grows, and then these are symptoms that almost everybody tends to ignore until it's a problem. It could be unusual weight loss, it could be sudden lumps. And then, yes, it's very easy to sit on this side of the table and say, it's because they don't understand anything about their healthcare. That's why they are not usually taking care of their health. But it's not entirely true. There's a woman that I grew up with. She died from breast cancer. And I remember this woman tying wrapper around her breast in so many layers just so she could hide the smell. She knew it was cancer. She saw the signs. But then again, pay for it, she couldn't pay for it. She couldn't even access care, and she died from it. And she's not alone. And that's because a lot of us in Nigeria pay out of pocket. Okay, let's use health insurance. You use health insurance, and then you find out that a lot of health insurance schemes do not actually even cover cancer treatment. Why? If we're being honest, cancer treatment is actually very expensive. And then again, in some places it's not accessible. There are certain states in Nigeria that you probably have to travel out of the state in order to get treatment from cancer. You're going to add that travel, you're going to add the travel of the caregiver, you're going to add logistics to their care. When they come into Lagos or when they come into other states where they can probably get treatment for this care, you're also going to handle taking care of themselves while in that state, which is adding to the bill that you're paying out of pocket. Where you live should not determine whether you live or die, especially when it comes to health. At the very least, give us a choice. A lot of those drugs are not even made here. They are made outside. By the time they come in, you have dollar increments, you have variation. Sometimes even the channel in which it gets to you, some people are going to mark up some things and all that, and it's going to affect the treatment or the price of it. I think it's time we should actually come together and talk about this. Because you might be here looking at it and then you'll say, no, it's not my portion. Cancer is not my portion. In 2022, I fought a brain tumor. I never knew it was going to happen to me, despite all the healthcare that I do. It can happen to anybody. But what matters is that no matter where you are, who you are, you should be able to get treatment for cancer, especially in Nigeria, without going broke. That is the basis of universal healthcare, and that's why we do what we do. Yes, on one part, you can ask people to prevent, and we're talking about preventive healthcare. That's why myself, the 100K Club, and a couple of other people have been running preventive campaigns. But how many people can we reach? You can't reach the millions, you can't reach everybody who is in Nigeria. You can only get a small fraction. Add that, then you have other people, the Nigerian Cancer Society, you have apps like Uncle Paddy that have been educating Nigerians about cancer and even connecting them to care. You have NSIA Lutz, you have Lakeshore Cancer Center, you have quite a number of people who are trying their damnedest best to ensure that a lot of people actually get access to healthcare. But then again, how many people can you reach? So you can see that there's a huge gap, especially when we're talking about the National Health Insurance Scheme, for instance, which a lot of people, you've been telling us to afford it, you've been telling us to get to it. But let's look at it from an unbiased point of view. There are people who are on the National Health Insurance Scheme, and treatment for cancer is not included in many of the National Health Insurance coverage plans. Okay, you go outside and you get an insurance scheme from outside, and probably the ones that are most likely affordable for people who are like in the middle class, lower class, we're not talking about the very premium ones, do not have cancer care. Do not have cancer care as part of the things that they take care of. Let's leave cancer care. Let's look at the diagnostic tests that people can actually go into in order before they even get cancer. Things like CT scans or MRIs. Many of them are not included in some healthcare, in some health insurance plans. If they're probably included, you're paying a little bit above premium. So you can see there's a problem. How do we actually solve these issues? And I'll not sit down here and say that the Federal Ministry of Health has not done some things. One of the plans that were rolled out was the National Cancer Control Plan. And part of the things that I was supposed to do was reduce the exposure to risk factors of cancer, ensure access to cancer screening care, and at least improve the quality of life for people who are actually dealing or living with cancer. But we still need more. If you go on your social media platforms, a lot of the things you will see are people raising money online. Oh, help my friend that is dealing with cancer, help my mother that is dealing with this cancer. Sometimes I get a lot of DMs, I get a lot of requests. I don't know what to do with them simply because I can't. So if as a person we're getting overwhelmed, imagine the state of the families of other people. We have to go back to the stage where care, universal health care, is in the middle. We have to demand for better health care. But at the end of the day, the major concern still remains: who is paying for the cancer care? There's a little bit of a problem, there's this, there's that. Let's go to Ghana. Let's go to Kenya. These countries have similar GDPs like Nigeria. Yet, 72% of breast cancer patients in Nigeria paid out of pocket. Let's not forget that if you're talking about the cancer that has the highest mortality rate, people are dying from it anyhow, it's breast cancer. Let's go to Kenya. Kenya, their health insurance scheme covers cancer care. And only 8% of breast cancer patients actually pay out of pocket. Ghana, 45%. So you can see that the numbers are significantly lesser than Nigeria. If those countries have achieved it, we can. We need to go back as a country where health is actually among the top things that we care about. Or else we're just playing mouth service to it. As I said, I commend the federal government, commend the Federal Ministry of Health for a lot of the initiatives that it has rolled. But I'm simply saying that we need more, especially as the Nigerian people. Yeah, I know this is not the American Nkechi that you wanted to hear today. But it's just a wake-up call. When your politicians are canvassing for your votes, make sure that they care about your health too. Let's hold people accountable. Your local government chairman, start from there. Your state governors, your ministers, the people who have been put in public positions, start from there. Demand accountability. Or else, we're all in the hands of the Lord. That's why a lot of us pray in Africa. There's nobody else to turn to. And it shouldn't be that way. Emeka Nkechi, I'm sorry I spoiled your day this morning, but please, universal healthcare is all right.